I'm Vipul Dua. I'm an orthopedic surgeon. My medical school was in India, in New Delhi, in one of the best medical schools there. Following my training in the medical school, I migrated to the US, and I was trained in orthopedic surgery in one of the finest hospitals in New York. After my basic training in orthopedic surgery for 5 years, I subspecialized in total joint reconstructive surgery of the hip and the knee, again in New York City. And I've been practicing for the last 6 years, and for the last 4 years, I have been with ECHN. When I was in medical school, I was doing an internship in one of the hospitals, and I rotated through the orthopedics department. The one thing which amazed me at that point was surgery for a broken hip. I saw this old gentleman who had fallen the previous day with a broken hip. The same day, the orthopedic surgeon there replaced his hip. And the same evening, after a few hours, he was made to get up and walk. And that was a life-changing moment for me. I decided that, this is instant relief and instant gratification for the surgeon and the patient's family, and the patients are very happy to see that somebody who has a broken hip can get back and start walking the same day of the surgery. Really drew me into orthopedics, and precisely for this reason, when I finished my training in orthopedic surgery, I subspecialized in joint replacement surgeries. First of all, I like to listen to the patients. My first priority of my patient care is listening to the patient, listening carefully, and then addressing their problems one by one. I also believe in keeping abreast with the latest techniques and innovations in orthopedic surgery, especially in hip and knee reconstructive surgery, and providing my patients with that new knowledge. I also believe in involving my patients in their own care. I want them to be as a team. Coming to ECHN was perfect for me because I operate both at Manchester Hospital and Rockville Hospital, and I find no difference between the operating room at Manchester or at Rockville or at Lenox Hill in New York. I still use the same state-of-the-art equipment I used to use in New York. And more importantly, the staff both at Rockville and Manchester, the nursing staff in the post-operative, room or in the floor, gives them very personalized care. It's not the city. There are small hospitals, but they're good hospitals. And I have not had a single patient who has not come back to me in the office after their surgeries and not felt good about the care they got both at Rockville and Manchester.